frustrating. I get it. Do you want a high deductible, out-of-pocket costs? Paying for your prescription drugs is becoming impossible. Most of you don't know anything about your drug plans until you get sick and then have to come to a pharmacy and see someone like me. And I've told you guys this before. By then, it's too late.
Security, the pharmacy, security, pharmacy.
Regulators, we are back here on Pills, Potions, and Poisons. And guess what? It's that time of year again. If you have insurance, you've been sick, and you had to go to the pharmacy, then you know exactly what I'm talking about. I'm NAllenRx, and I'm a licensed pharmacist, and I'm usually not here in a professional capacity, but for this one, I had to be. Every single year in January, these insurance plans, they change, they evolve, but we're going to dig into the good, the bad, and the, of the insurance plans when you go to the pharmacy for your drug coverage. We've talked about this before. Most of you don't learn anything about your prescription drug coverage until it's too late. Now you're sick or you had to go to the emergency room. They give you a hard copy for your prescription or they send it in to us electronically. We start the filling process. Then wham, the adjudication process is rejected. The insurance is not accepted. Why? Because it's the same insurance from last year, but it's a new year. Now we have a whole list of issues that we have to consider when we fill in this prescription for you and that you have to consider as the consumer of the product. How does the saying go? New year, new me, new year, new plan. And with that new year, many of you find that your insurance plans have undergone some changes. These changes may include alterations in your medications that are covered under your formulary, which may lead to some surprises when you come into the pharmacy. What's a formulary? Well, this is a list of prescription drugs, brand or generic. This list is developed by physicians, by pharmacists, by pharmacy benefits managers, by other members of the healthcare team. Now, some of your medications that have been previously covered under your other plan may not be covered under this one or not covered as much. This is what I mean. This is where aspects of your formulary with your specific drug plan are vital. It's very important. Things like the tiers of the drug, which level is it? Tier 1, tier 2? Is it brand? Is it generic? Is there another medication that's more cost effective? Is it preferred under this plan or is it non-preferred? Do they have another drug they want that's in the same drug class but is a little cheaper to get? Or this drug works a little bit better or works as better and it's been out a longer time but it's cheaper for them to purchase to get to you? Prior authorizations. Some of you may say, well, my doctor wrote this prescription for me. Of course they want me to have it, but that's fine. Insurance wants that in writing. They want a little bit more information. They want to make sure that there's not another more cost-effective drug that can get the same job done, cost-efficient product that they could use versus this drug. Prior authorizations, step therapy. They may say, we need you to try a Pepsi before we can step you up to PPI like omeprazole. You step it up from here. Have they tried this? Have they tried that? These are all things that the insurance companies consider when pricing a drug and that you should consider when choosing your insurance plan. All of these terms, I'm sure that most of you are unfamiliar with, and it's just as difficult for us to explain to you guys.
Insurance.
And when you come in the pharmacy and you say to me, well, I didn't pay this much last month. My copay was $0 last month.
And it was yesterday's price.
Keep this in mind. Last month was December, right, of the previous year. We're now in January where your new insurance plan has kicked in. Started January 1st. And all these things that we just spoke about have to be considered. And the price may be different. I believe you. I'm looking at it. I see here, December, you paid $0 for a 90-day supply that you picked up here in the pharmacy with me. I believe you. I see it. But do you believe me? Are you listening to me? I'm trying to tell you, you have a new insurance plan. It has gone into effect. And all those things that you selected back in the fall, now they matter more than ever. Your plan has changed. And with those changes may come a price change. This price change could be higher, or in some cases, it could be lower, or it could require changing to a different drug altogether. Most insurance plans have annual deductibles that reset at the beginning of each calendar year. That's not limited to just prescription coverage. It's medical, it's dental, it's vision, the usual suspects. This means that if you met your deductible last year, you may suddenly find yourself paying significantly more this year to meet your deductible again. This is often a surprise, but don't let it be. Expect this every single year. If you're not prepared, this could lead to setbacks financially and lead to less positive patient outcomes, especially if you're on a fixed income or you're taking expensive drugs or you're taking multiple medications. Be prepared. Be prepared.
Be prepared.
The beginning of the year always brings a lack of clarity or misinformation. It's a confusing time for most patients, especially when it comes to the high cost of the prescription drugs. Most of you are not even aware of what your plans include, even though you are the one that selected this drug plan. Open enrollment is usually once a year during the fall, or if you have Medicare Part D, it could be anytime, whenever you're ready to turn 65. As pharmacists, we can't steer you, which means we can't tell you which plans to select, because a lot of times you guys will come to us and you ask us which plan would be best for you, but we don't know and we can't do that because it's illegal. But deciphering drug coverage is crucial. It's crucial, but it's confusing too. It's frustrating. I get it. Do you want a high deductible, out-of-pocket costs? Do you need long-term disability? Do you need short-term disability? Are you planning on becoming pregnant? Do you need some other extra accidental stuff? What medications are you currently taking? How many medications are you currently taking? Which one will be best? Do you need flexible spending? Do you need health savings account? Some unexpected diagnosis? COVID? None of us could have been prepared for that. Even something as simple as your pharmacy that you like to use. Depending on how they rank, this pharmacy may be preferred over another one, which means sometimes the pharmacy that you love to go to is not the preferred pharmacy for the plan you selected. What does that mean? I can get your prescription over here where I work at, but that pharmacy is going to give you the better price. We're going to give you a good price still because that's what your plan is. But if your plan says we prefer that pharmacy, then they're going to give you the best price. They may want you to do 90-day. They may want you to do mail order. It's so many things to consider that it's really, we understand the difficulty in selecting these plans and then the surprises that come along with the ones you have chosen. Delays in getting your prescription medications, increased stress on you and us, and potential non-adherence to medications due to the cost or availability, which is not what any of us want. All of these challenges, they underscore the importance of patient education and proactive communication between us as pharmacists, you, the patient, and these middlemen that are insurance providers. We all want to make sure that you can effectively manage your prescription drug needs at the beginning of next year. So good luck, guys, and you can always drop any questions or comments down in the comments section. Don't forget to like and subscribe to this channel. I'm NAllenRx, guys, and these prescriptions, they keep piling up, and these phones, they never stop ringing. It's always LOVE, guys. See you in the next one.